probably you can guide me if that's okay.
Yes, Ruth, I think that is okay. We can start so that we save on time. The rest will join us as we continue.
All right. Awesome. So in the call, I have seen someone who will be called Kivandi. He will be helping me to moderate the Q&A questions after the presentation way later. But as we get started, I have asked that if you've joined the call, you can introduce yourself or type your name in the chat box so that we know who is in, and then we can continue. So, Director, as we wait for the rest to join us, I know we are expecting the Deputy CEO for Media Council of Kenya will be joining us. Once he does, then perhaps we will give them a chance to speak later, and also the Director of Communications. But I want to give it to you, Director, to take it up.
Yes, thank you very much, Ruth. Good evening, everyone. I want to take this time to welcome each and every one of us to this sensitization session. We are going to take about 1 hour, and that is the main agenda of the day. So before we start, I want to again ask Gerald Maina to lead us in a word of prayer.
Thank you, Director. Good evening, everyone. Let's believe and pray. Heavenly Father, creator of heaven and earth, we come before you this evening. Thank you for the gift of life, good health that you have bestowed upon us and our families. Your Father, thank you for this day that you have been with us since morning. And as we come to the end of the day, we have a session that is ahead of us for the sensitization on Monkeypox to our journalists. Your Father, we ask that you guide us, be with us as we share knowledge and information concerning this disease. Your Father, be with us. And as others join, we also welcome them. Your Father, we ask that you be with us throughout this meeting, and as we finish, we shall remember to say thank you. For it is in Jesus Christ we pray and believe. Amen.
Amen. Yeah, thank you very much, Maina. So, Ruth, I think I need to be guided. I don't know whether Bernard has joined. I've just seen a name, Bernard, the Director of Communications.
Yes, he has joined.
Yeah, so welcome, Bernard. I want to register apologies from Joyce, Madam Joyce, the Chief Officer of Public Health. She's unable to join us. So please accept her apologies. So I think we will straight away go to the just comments, short comments before we go to the real agenda. So I want to invite Bernard to probably make his remarks. Then I don't know whether there's the Deputy CEO of Media Council of Kenya has joined. Ruth, you'll be able to alert us. So Bernard.
Good evening, everyone.
Good evening.
You know, this is just an ambush. I've just been told to join the meeting, then I have to make remarks. Anyway, welcome everyone to this important session of sensitizing our journalists in Nakuru about the deadly disease which is come in our midst. Like all other plagues, when they come, we all have to look for ways and means of equipping our journalists so that they can report confidently and rightfully with the right information for them to be able to handle this plague or this disease that is now among us. And I want to congratulate the organizers of the meeting for the fast thinking about organizing this meeting for all the journalists in Nakuru to be able to be aware of the risks, the dangers, the symptoms, the causes of this disease, and how we can be able to educate the public to be able to avoid, or if one of them is infected, where to seek attention. And it is my expectation that from the meeting or from this session, our team from the county and our reporters from Nakuru will be able to contribute fully in terms of sensitization of the public, in terms of what the disease is all about, the symptoms, the causes, where to seek treatment, and how it can be prevented, and also be able to write and contribute confidently and knowledgeable enough on the disease that is amid us. So I welcome everyone and expect you all to be able to contribute to this important topic at this particular moment, because we as Kenya, just like other countries in the region, we are faced with this disease and we have to fight it at all times. I think that will be the end of my remarks. Welcome, everyone.
Yeah, thank you very much, Bernard, for those comments. We really appreciate your joining this meeting, and actually you are actually the patron of this specific activity that you're undertaking this evening. So before we invite the Deputy CEO of the Media Council of Kenya, I want to recognize the presence of my colleague, Dr. Joy Mugambi. Welcome, Daktari, and this is the time for you to make your remarks.
Thank you very much, Director Elizabeth and the team. I'm glad to be joining for the state in this meeting and be able to engage so that we are sending out the right message and clearing out disinformation so that we protect our community and we ensure that before this becomes a big issue, we are able to work together as a team. And I hope that from today's session, we'll get to learn a lot and be able to engage going forward. Thank you. Back to you.
Thank you for those remarks. I'm told the Deputy CEO of Media Council of Kenya has joined, so I want to sincerely welcome him and ask him to make his remarks.
Thank you. Thanks, Dr. and thanks for the Nakuru County Department concerned with health, and the journalists from Nakuru County, obviously appreciating the role of the Media Council Office, the colleagues in Nakuru office, Lucy and Mecha Joseph. Now, quickly, because it's an online meeting, I'm privileged, and on behalf of the CEO of the council, David Omoyo, who is aware that this the function is happening, we appreciate. I'm sure you are one of the first counties, I'm sure, that has organized and thought about doing this quickly, because as you are aware, Nakuru is also a trans county or town in addition. My name is Victor Buire, and obviously health. I was a health reporter for quite some time for the standard newspapers, and so such things obviously interest me. First, so quickly, colleagues who have joined, in addition to thanking the Nakuru County and being the first county to think and organize such an event, is that principally the Mpox outbreak, obviously you have already heard about it as an infection, and we just want to advise that given that this is a disease that obviously is affecting human beings, we want to request you, the journalist, the Nakuru County, to given the heart you have already shown and the attitude that you open doors for the journalists, your department concerned, open doors for the journalists who will want to do interviews, follow up, data, statistics, trends, and the latest information on the same, so that then they can factually report, they can give information of integrity coming from the experts. We would not want a situation of speculation and misinformation and information manipulation around the disease, because any outbreak that affects human beings has a lot of empathy and sympathy, and quickly a lot of people look at outbreaks where they are and cancel visiting or will even move. Nakuru, obviously, as a county, especially Naivasha as a county, hosts so many meetings conferences and within those hotels. So any misleading information around an outbreak or a devastating effect, that does not mean that people should hide if there is, but they should give factual information and largely what the county is doing to cope. Because once there's an outbreak, there's a likely anybody to catch it and get infected. But what mechanisms are there to minimize to minimize. So we want to request colleagues that the county opens an open door policy, maybe regular briefings, whether there's an outbreak or not, a case or not, but a regular update to journalists and to media about what is happening, and that would help a lot. And for the journalists, police, as we have always said, this is an infection that's affecting individuals. And so for that reason, the focus is on individuals, minimize exposure. One, as they say, seek and report the truth. Don't get into this excitement of reporting fictitious things or rumors to turn them into a factual story. So seek and report the truth. So seeking would mean talk to the doctors, both the county government and private people who are working in such field. Please minimize harm. When they do no harm principle in journalism, that once, even if an outbreak will be encountered, they don't report as if it's life and death, that the end is there to cause mayhem, to cause anxiety, and in that way. So report aware that this affects individuals and their families, the people, their victims who need to be protected against unnecessary exposure. The families need protection, and obviously, as we said, even the county at that level and focusing on what is being done to minimize the spread of the same. Be transparent and accountable in the manner you are dealing. Don't go to a facility, for example, where there's an outbreak and pretend to be a teacher or selling Coca-Cola, yet you are going to get a story. If you are doing a story, just be open and talk to the county to officially organize and allow you to cover it in well at your own individual level. So managing information to a way where we focus on to contain the situation, on the coping mechanisms, how our counties and Nakuru County dealing with the any coping mechanisms and how the individual will be of more interest than just focusing on the numbers affected, the deaths and the rest. Be also cautious about your own health, because you are also human beings, and there's a possibility of you being also in that sense affected. So take care of your own self, also self-care, that you don't unnecessarily like what people are doing in COVID, where you run up to, you want to stand on the grave of the dead just to say this was a victim. And then the following day, you remember what happened in Siaya and Kisumu when journalists went and carelessly started even reporting from the graves of suspected COVID, and they were affected themselves. So we need to be cautious that we are human beings, and the risk is also you can also get infected. And where you are a victim, obviously lies with the relevant health personnel, so that you are. Let's not your editors or anybody force you to create a disease that's not there. There might be symptoms that are similar, but don't force. Just make sure you confirm the disease, the whatever, with the relevant authorities. Other than that, we will work together, and want to appreciate with any county, including Nakuru, that has already started to ensure that the coverage is more responsible, professional, and curated in a way that there is information of integrity, factual information, data that is relevant and gotten from relevant departments and people. And we'll urge Nakuru County, like you have already started, to have regular briefings and engagement with journalists, so that we don't allow speculative reporting. I want to wish you well in the meeting, and thanks for organizing this.
Yeah, thank you very much, Victor. Those comments have actually summarized exactly what is expected of the journalists after this sensitization, and we really appreciate your presence here. We also appreciate the attendance of the journalists here, because I think we have actually worked together in the past. We even have a forum, a platform where we share some information. but I think this should actually be something that will even bring us close together. So we sincerely appreciate your presence and even the work that you've been doing. I know we've been working together with some radio station, TV station, and we've been having the radio talk shows and even the TV talk shows. So we really appreciate the support that we've even had in the past. So I think we are approaching the climax. So and I think we are going to be taken through, we're going to be given the situation update, but probably for your information is that Nakuru County, we are one of the counties that are at high risk because of the northern transport corridor. So as a county, we have mapped 8 high risk areas where we've actually targeted some interventions in order to detect these diseases if they occur. And at the same time, we are able to, the people around that area should be able to prevent this disease. So we will be expecting that we will work closely together, especially to pass information to the members of the public, educate them on how to recognize or to detect, how they can prevent themselves and how they can report so that we are able to put intervention measures in place adequately. So at this juncture, I now want to invite our CC, Waziri Roslyn Mungai, to make her remarks. Then after that, I will invite Moses to take us through the presentation. Waziri, karibu.
Thank you very much, Director Elizabeth and Director Dr. Joy Mugambi. Director Elizabeth Kito is the Director of Public Health. Director Dr. Joy Mugambi is the Director of Administration and Planning. We have a third Director of Medical Services, Dr. Daniel Oyena, who is away at the minute. We received apologies from our two chief officers, Dr. Marima Medical Services, John, and the Chief Officer Public Health, Joyce Njeso. But we are here with a number of colleagues from the department's leadership team. We welcome all of you, our esteemed journalists, to have this conversation with us, exactly the way Director Elizabeth and Joy has said and what Victor has said from the Media Council. We are here to share information, to give you facts. We will certainly be listening to the facts that we have gathered so far. We actually have a very robust disease surveillance unit. We meet every Monday morning without fail between 8 o'clock and 9 o'clock, even before the Monkeypox outbreak. So this is something that we do, and we are very, very happy to begin a new chapter conversing with the journalists based in Nakuru. We will continue to be open as we can. We will continue to be available to respond to questions. And I believe there's going to be a question and answer session at the end. So let us, without any further ado, invite the technical team from the surveillance unit to take us through the facts and figures, perhaps a little conversation about the case definition or MPOC, and what is that we are asking our journalists first with regard to public education. Thank you very much. Yes.
Yeah, thank you very much, Waziri. I think I want to invite Moses. Moses, please, the floor is yours.
As Moses set up, thank you, Director Elizabeth, for taking us through that. As Moses goes on, in case you do have any questions, you can be dropping them at the chat box. The ones that will be able to be answered from there will be, but then we will have a plenary after the presentation to handle any other queries.
Yes, thank you very much, Ruth, and thank you very much, Director. I'll be doing a presentation in a few seconds. So I request you confirm to me if you are able to see my presentation.
Yeah, Moses, I'm seeing Mercy's hand is up. I don't know whether you have any concern, Mercy. Mercy Kosgei. Sorry. Moses, please go ahead.
Yes, thank you very much. So this is a presentation that we have developed to assist us in terms of sensitizing our media persons within the county. And we are going to look through the disease, the background in terms of the Mpox, a little bit about updates. In other words, what do we have currently in the country and also in the county. Then we shall look at the disease itself, what is it, and how does it spread, how does it present itself, and how can we prevent ourselves from contracting the disease. Then we shall also look a little bit about what do we require from the media and also from the community. And then we shall also do a bit of what exactly has the county government of Nakuru done in terms of getting ready for this particular outbreak. So in a nutshell, Kenya confirmed the outbreak of Mpox on 31st July 2024. This was announced by our Director General, Dr. Amoth. And so far, cumulatively, we have reported 5 cases in the country. These are confirmed cases. We also have other cases which are under investigations, but so far we have confirmed 5 within the country. We want to say that it's not only Kenya that is reporting cases. We have had a number of African countries reporting Mpox cases, including DRC Congo, Rwanda, Burundi, Uganda. And so far in the year 2024, more than 17,000 cases have actually been reported across the countries, and confirmed are more than 2,800. That is out of the more than 17,000 cases that have been line listed. So we have actually lost over 517 persons to this particular disease. And by 2nd September 2024, in Southern and Eastern Africa, actually 367 confirmed Mpox cases had been reported with 3 deaths. These were from 5 countries, including Burundi, which reported 328, South Africa 24, Uganda 7, Rwanda 4, and Kenya by then had reported 4. But by now, as I've said, we have reported 5. So Mpox has actually been declared a public health emergency of continental concern by our Africa CDC. This was done on 13th August 2024. And following that, also WHO declared Mpox a public health emergency of international concern, that is fake. This was done on 14th August 2024, actually the following day after Africa CDC did the same. Actually, the WHO ranked the outbreak as a grade 3 emergency, and that means that there's call for international coordination in terms of response to this particular outbreak. So in a nutshell, we have seen cases 5 of them in the country, and the first case actually was reported from Taita Taveta. Then we had another one from Kwale County. Then third, we had Nairobi reporting a case. Nakuru reported the 4th case, and then Mombasa reported the 5th case. So total number of cases, as I said, are 5. We are saying that 2 cases so far, according to the reports we've received from the national, from the MOH, that is from the National Ministry of Health. 2 cases have recovered fully and have been discharged. We have 3 cases that are still under treatment and under care. One of the 3 is actually within Nakuru County. So more than 86 samples have so far been taken, and more than 61 have tested negative. Around 33 are still under investigation. And looking at our points of entries, we have screened more than 615,397 travelers, and sensitized more than 107,397 persons on Mpox. Looking at Nakuru, as I've said, we have one case, and this case was detected on 30th September 2024. He's a 37-year-old male truck driver who had history of travel from Rwanda and Uganda. So the case presented with a rash, fever, headache, sore throat, a severe eye ache, and general body weakness. And these presentations, or rather symptoms, he reported that he started experiencing them on 23rd August 2024. So far we have had like 15 contacts having been identified within our country. Within our county, and some of these contacts actually come from outside the county, and all of them are under follow-up. So these are some of the presentations in terms of the disease, that is Mpox disease. These are some of the rashes that normally we can see from a patient suffering from Mpox disease. Looking at issues to do with the case definitions, we're saying that for us to say that somebody is having Mpox, this person must have been undertaken through a confirmatory test in the laboratory, and a detection of Mpox virus done through what we call PCR, that's polymerase chain reaction, where we look at the DNA of this particular virus. Somebody who does not have the virus or a non-case is somebody who has tested negative for Mpox virus by the detection of unique sequencing of the DNA through polymerase chain reaction. Case definition continues. We're saying that within our community, we are looking for any person who is having hotness of the body and is not responding to treatment, has a rash, that is has a rash all over the body and all over the body or part of the body, and has a history of travel to a country that is reporting Mpox cases. These countries include DRC Congo, Burundi, Rwanda, and maybe Uganda. And then a contact to Mpox case is somebody who is who has been exposed to an infected person during the infection period. And the infection period is the period during which the infected person is showing symptoms. This is the period beginning with the onset of the first symptom in the index case, and ends when all scabs, that is the scales that is coming out when the rashes dry off have actually fallen off. So during that period, somebody is infective and can transmit that infection to any contact that he comes across. So looking at this disease in a nutshell, the disease, as we have said, is a zoonotic illness caused by Mpox virus, a specific species of the genus Orthopox virus. So this species of the virus has two clades. These are small, small variants under Orthopox viruses. We have two clades, clade 1 and also clade 2. So clade 1 is more common in Central Africa and is more virulent. That means that its infectivity rate is very high and is endemic in Central Africa, as I've said. Then clade 2 is endemic in Western Africa and has less severity. And in other words, it's less virulent. Then we're saying that the genus Orthopox virus actually is coming from the family called Poxviridae, and within this family we have Orthopox virus, as I've said. We also have others, including Parapox virus. We have Molasipox virus. We have Yatapox viruses. All these are actually known to actually infect human beings. And in terms of the Orthopox viruses, we also have the species. Including vaccinia. Vaccinia actually has been used as a smallpox vaccine. We also have the variola. Variola is the one that is causing smallpox. Then we have the Mpox itself, and then we have the cowpox. The vaccinia, which is the smallpox vaccine, can also be used as a vaccine for Mpox, the current outbreak we have. So transmission, we are saying that this disease can be transmitted through direct skin-to-skin contact. That is when you get into contact with the rashes or the scabs. when you have a contact with the body fluids of somebody who is infected. The body fluids we are talking about here includes semen, vaginal fluids, amniotic fluids, breast milk, and or even blood. Then it can also be transmitted through contaminated objects like the sharp objects that probably pricked somebody who had the disease, and then he pricked another person who probably did not have the disease. That can lead to transmission. Vertical transmission can also happen. Vertical transmission is whereby a mother who probably is infected with the disease passes the disease to her unborn child. And then we have animal to human transmission. The disease was first detected in the monkeys that were being used in a laboratory for some science. And since then, it had also been detected in most of the rodents that we have around. And again, we are saying that during that animal human transmission, especially as it happens in the West Africa, where they hunt the monkeys, possibly transmission happens during that interaction. Then looking at the prognosis of the disease, that is how this disease progresses from the time it infects an individual to the time an individual recovers or dies, or the outcome is realized. We have incubation period going between 5 to 21 days. But again, this incubation period can be as short as 2 days, but the one documented currently is 5 to 21 days. During this incubation period, the person who is infected will be showing no symptom and may not really be sick. Then after 21 days, that is the 22nd day to the 25th day, we will be seeing a febrile stage. During this stage, the person who is infected will start showing a fever, lymphadenopathy, headache, chills, sore throat, malaise, and fatigue. Lymphadenopathy is actually the inflammation of the lymph nodes. While headache, I think we understand what headache is, chills, sore throat, malaise, and fatigue, which is actually tiredness. Then between 2 to 4 weeks, we shall be seeing rash. The rash starts appearing on the skin. And then on the as we approach the 5th week of the disease infection, this is actually the recovery stage, where the scabs start appearing and actually drying out and falling off. So during this time, actually the person becomes free of the symptoms and may not be showing any symptom. And at this stage, the person becomes less or rather non-infectious to others. Then we have differential diagnosis. Mpox is a disease that presents similarly with several other diseases, including herpes simplex, a virus that causes genital herpes or the oral herpes, varicella zoster virus, this is the chicken pox, the molluscum contagiosum virus, the enteroviruses. These ones affects mostly the guts of the human being, and they can actually present with fever, runny nose, sneezing, cough, skin rash, mouth blisters, body and muscle aches. If you look at these symptoms, they are more or less the same as the symptoms that Mpox presents. Also measles also presents very clearly with rashes and some of these symptoms, so it's also a differential diagnosis. Then we have scabies that shows a lot of rashes on the body. Treponema pallidum. Treponema pallidum is actually the syphilis that causes a lot of rashes around the genitals. So this can also look similar to the rashes that are caused by, Mpox. Then we have bacterial infection of the skin, which can lead to rashes on the skin, and also the symptoms that we talk about, including fever. Medication allergies and also parapox viruses, which are also causing related conditions. And then chancroid. Chancroid also causes a lot of, rashes around the genitals. This is also a sexually transmitted infection. Then case management. In terms of case management, we're saying that most of the viral infections actually, as things stand now, may not be having direct treatment in terms of medication, but in most cases we have vaccines against these viral infections. Same with Mpox, we have a vaccine, but currently we don't have this vaccine in Kenya, and therefore we rely mostly on symptomatic management of the confirmed cases. Symptomatic management is where we treat the symptoms that the disease presents. For example, probably the disease is presenting with high fever, we give you drugs that will help in terms of lowering the fever. The disease is presenting with rashes, we give you drugs that is going to assist the body not to react, in other words, to slow down the process of producing rashes. Then we have people who are normally high risk. We have people like pregnant women, immunosuppressed individuals, the infants and young children under 8 years. These people can actually lead to severe diseases when they are infected, and also can give some complications we are going to see in the next slide. So this kind of persons, when they are infected, we normally advise that they get to the hospital and actually get close hospital care. Those people who are also presenting with complications and may not be within this bracket of high-risk population, also we advise that they present to the health facilities where they need to be getting facility-based care. Those who are presenting with mild uncomplicated Mpox disease, currently the protocol says that they're supposed to be taken care of at home under home-based isolation and care. But in Nakuru, we are saying that any person who is actually presenting with any symptom, any suspected case, needs to actually be isolated, so that we really get to the bottom in terms of ensuring that we don't have any community infections currently. So the complications, number one, include secondary bacterial infection of the skin, subcutaneous accumulation of fluid in the crusting phase, exfoliation of the skin, severe pneumonia or respiratory distress, corneal infection or ulceration of the cornea, loss of appetite, vomiting, and diarrhea, which can actually lead to severe dehydration, and cervical lymphadenopathy. Another one would be bacterial infection of the blood. This comes around as a result of the open wounds during the peeling off of the rashes. That can actually allow bacteria to enter into the bloodstream to cause bacterial infection. We have inflammation of the brain, in other words, encephalitis. We also have pregnancy complications, including bleeding, miscarriage, and stillbirth. And finally, we may also have death. But what I can say is that these complications are actually rare. In most cases, people get infected, and actually, if they are not probably part and parcel or another in the group of the highly susceptible persons, the ones I've just said, then in most cases, they actually end up not showing any symptom. Most people don't show any symptom, but those that show symptom under proper management, they actually recover. And therefore, death actually becomes very low. We have very low case fatality when it comes to Mpox, especially the one that actually has been isolated in Kenya, the clade 2 subtype B, less than 1% case fatality rate. In terms of diagnostic test, we are saying that between 5 to 21 days, this the incubation period, we are not able to do any tests because at this particular time, we are not able to have the CRAS, we are not able to do what we call the swabs and what have you. So during this stage, the person may not be tested for Mpox. But between day 22 to day 25, that is the febrile stage, we can actually do what is called tonsillar and nasopharyngeal swabs for PCR. PCR, I said, is polymerase chain reaction, and this is normally the test, or rather the laboratory test that we use to identify this particular virus. Then after 2 to 4 weeks, this is the stage where we have the rash. We can do a swab of the lesions for PCR or for antigen detection methods. Then during recovery, again, Remember, during infective stage, the body produced a lot of antibodies against this virus. So during recovery, we may not be able to do swabs, but because the lesions have dried out, but we can be able to actually take serum from the blood to do antigen test. But in Kenya, we have not done a lot of serum tests or blood tests. Currently, we are doing the swabbing of the lesions, and then we subject them to PCR test or the antigen detection method. Factors that can contribute to false negative could include poor quality of specimen, wrong sample collection, inappropriate handling or shipping of the sample, DNA extraction, or operator failure, as it happens in the laboratory during testing. So we are stressing so much on IPC. IPC is infection prevention and control, because we have realized that, rather, research has shown clearly that this disease can actually be prevented if we use high standards of infection prevention and control. And what are we saying when we are talking about infection prevention control? We are talking about issues to do with hand washing with soap and water, that is hand hygiene, or use of alcohol sanitizer. And of course, the recommended alcohol sanitizer is that which contains up to 70% of alcohol. Then we can also use personal protective equipment, the PPEs. For example, the one that is at our disposal, especially for the public, is the face mask. Then respiratory hygiene, or the cough etiquette. When somebody is coughing, especially in public, he's supposed to actually use his elbow to protect the others who probably are around him. Safe injection practices. This normally happens within our facilities. Reprocessing or use of reusable medical equipment. This one also. Environmental cleaning, especially in the homes and where we live. Waste management, especially in homes and where we live. And even in our facilities, we are very true to this. Linen management. This is where probably somebody who is suspected to have been infected by the disease. The beddings that this person uses, they're supposed to be treated in terms of cleanliness. They're supposed to be cleaned. And if possible, if there's some disinfectant, they need to be subjected to disinfection so that the next person using them do not get infected. Additional precautions when it comes to IPC, targets contacts and also droplets and also airborne. But these ones, so we may not recommend them, especially for the community, because these ones we use them especially when we have real cases, which currently we have in our facilities and not at home, as I explained earlier. Then risk communication and community engagement. And actually this is where we request the media to support us so much. We need to tell the community about this disease, the level of risk, the transmission, signs and symptoms. And secondly, we need to tell the community about prevention and control of this disease, including personal and environmental hygiene, issues to do with vaccination. And of course, as I've explained it very clearly, Kenya currently has no vaccination. We have not started doing the vaccination, but we are doing the supportive treatment and we are caring for our patients. Demand for generations and also safe and dignified burial, just in case those ones happens. Currently, we have not had any case of death as a result of Mpox. Issue to do with the treatment. We need to tell the community about the need to seek early treatment as to avoid issues to do with complications that probably could result as a result of this particular infection, and also issues to do with visual loss. Importance of seeking medical attention early. This is very key. And also what to do and what not to do in case of suspicion of the disease. Mental health and psychosocial support, because this is a new disease. People get terrified, people get scared when they hear probably that somebody is having this particular disease. And also issues to do with the stigma and discrimination. When we stigmatize our people who probably we are suspecting, they feel so low, and this can actually affect them psychologically. Other issues include emphasis on importance and relevance of frequent hand hygiene. I think I've talked about this with clean water and soap. Public health measures, use of PPEs, especially for caregivers, because we have some suspected cases probably in the community and also need care just like any other person. They need the person who is actually taking care of them need to observe issues to do with personal protective equipment. In our isolation facilities, we are actually up to this. Promotion and mobilization of vaccinations for persons who are at risk. I think probably maybe at higher level, the media can actually help in terms of advocating for a vaccine, especially if we continue reporting cases in Kenya. Seeking information, the importance of seeking information for from incident commander. In our county, we have our Director of Public Health as the person who is giving out information concerning this particular outbreak. So in any case, the community would request any information, we direct them to our Director of Public Health for more information. And also the importance of reporting any suspected case to the nearest health facility. We receive reports from through any of our health facilities, especially concerning, incidents of suspected cases, concerning any outbreak, concerning any health emergency. Other than health facilities, you can also report these cases through our county emergency toll free line at the 0800-724-138, or you can use our hotline 0799-032-032. Thank you very much. In terms of preparedness, the county has actually done our contingency plan, so this has been developed. This outlines what we need to do just in case we get a disease or an outbreak. Sensitization and training of our healthcare workers has continuously been done, and a number of our healthcare workers, I think probably all of them, have actually had training in terms of how to manage a case. Mapping of risk areas, as said by our director, we have already mapped the most at-risk area, which probably, by default, fall along the northern corridor. That is the road stretching from Total to Kinungi. Enhanced surveillance and active case search. Our surveillance team are on ground, including our CHPs. Actually, any case detected, we are able to manage the same. Prepositioning of necessary drugs and non-farm items in facilities that probably are near these hotspots. Case management is happening. Like right now, we have 5 cases. One confirmed case and 4 still under investigation. These cases, as they continue being under investigations, we are managing very nicely at our health facilities isolation sites. We have also set aside isolation sites and equipped them with the necessary drugs, equipped them with the necessary human resource, and also with the necessary non-farm items required for them to operate fully. And as I've said, we also have a toll-free line in place. Thank you very much, and back to you, Director.
Yeah, thank you. Thank you very much, Moses, for that elaborate presentation. And I think at this juncture, we will go to the plenary. And I also want to take this time to welcome those who have just joined. So, karibuni sana. So I will hand over the floor to Ruth to lead the moderation during the Q&A session. So maybe before I hand over to Ruth, I'm seeing Dr. Joy's hand is up. Dr. Joy?
Thank you very much. Just to add that in that training of health, public sector healthcare workers, but we have also been working on capacity building of the private. We have engaged providers and are working to ensure that they are also prepared. Thank you. Just wanted to add that.
Yeah, thank you. Thank you very much, Daktari. So Ruth, please take over the floor. You can now lead this session.
Thank you so much, Director and Moses. For those who are asking, we have the health leadership. Elizabeth Kipto is the County Director for Public Health. Madam Roslyn Mungai is the County Executive Committee Member for Health. Moses is the Manager of the Public Health Emergency Operations Center. Mr. Gerald Maina is the Head of Preventive Promotive Health Services in Nakuru, and Dr. Joy Mugambi is the County Director for Health Administration and Planning. So just to get straight into the Q&A section, I would want to bring on board Mr. Kyoko Kivandi. He is also a journalist in charge of Egerton Radio, and we would really want to bring on board the learning institutions on board, and this is a media that reaches that audience. So Mr. Kivandi will help me to lead the plenary session. Yes, thank you. As Kivandi comes in, we can be shooting our hands to ask questions.
Health leadership at the Nakuru County government. Let me go straight to the in-call messages to see if there is any message. So far, none. There was only one question that was asked by Kipchumba earlier on, and it was already responded to. So this is our time. Let's ask questions. One of the questions that I would have asked was already addressed by Moses Obiero earlier on, and that was about the vulnerability of Nakuru County. I think you already, explained that. So let's see whether we have questions. Let's have questions.
It's good to know that they can also be sent in the chat box, and then Kyoko, you can be reading.
Yeah, there's one question from Mercy Koske here, that majority of Nakuru residents don't know what Mpox, maybe what the county government is doing to ensure that sensitization, especially in Matatu stages. I think this is a question as well as a comment. You could pick that and see what to respond to. And maybe as you get to answer that, you could also pick this one from Mercy Gaki. Mercy here from my Mahi ward. And she's saying that from the presentation, does it mean that the disease cannot be detected immediately, like in COVID? I think the last word there is COVID. My other question would also be about the misinformation about the disease. In the very way we had misinformation about COVID, what are some of these myths that you think are important for us journalists to explain to our audiences? All right, I see that Kipchumba has raised his hand. So Ruth, are guys allowed to just shoot their questions?
Yes, they can shoot their questions. Okay. Perhaps we can take Kipchumba's one, then give an opportunity for the first three to be responded to.
Okay. Go ahead, Kipchumba.
Okay. Thank you very much. I just want to, my name is Daniel Kipchumba from Egerton Radio, and I just want to know if the county government through the health department has trained community health promoters, and if they have been trained, how many have been trained, and how many are, what's the total number of county health promoters in Nakuru County as a whole? And then Mr. Obiera talked about isolation of the patients. What does he mean when he talks about isolation? Does it mean that there is a place, maybe at PGH, that patients are being isolated, like the way we saw when there was an outbreak of COVID-19? Or what does he mean about isolation? And then he also talked about symptomatic management. That now, kama mtu ako na joto anatibiwa joto, kama mtu ako na rashes anatibiwa rashes. Does that isn't that kind of suppressing the main thing, because he said that there are no vaccines and everything else? Isn't that suppressing the main thing, just treating the symptoms? And according to, maybe they have the inner information, or the county health director can tell us if there is any plan to get tiba kamili kabisa, tiba moja ya ugonjwa huu, or is it will continue, treating the symptoms only, something that maybe it will come to reoccur again and all that. And then lastly is to call upon the leadership of the county health department to be available for journalists to ask for interviews, especially on this matter. I have a lot of interest on reporting about what the county government of Nakuru, through the Department of Health, is doing to make sure that we are safe, because we live around here. So be available. Isikuwe ni mambo ya kupigiana simu unasikia siko karibu, uliza fulani, nenda kwa fulani. By the time you get that information, maybe a week has gone, and this is a very, we are in a this is like an emergency. People need to know all these things as early as possible. Thank you very much.
Thank you so much, Kipchumba, our Kongowea Mswahili in Nakuru County. Maybe Obiero, you can take those ones, or whoever should. I think you just agree among yourselves who should answer which one and what time.
So I'll take the myths and misperceptions, and then my colleagues will take the detailed public health concerns that have been raised. Myths and misperceptions, we've had a number of people say, yes, there are people who have been putting on masks and say that they could get them in a crowd, but depends on the duration of lingering. It's mainly a contact disease. And then there are people who talk of probably if I'm swimming, will I get it? Yes, unless you're using shared towels or having contact with a person who has it around the swimming area. Unlike others, Mpox, yes, is deadly. It's a fact. It can kill, but if captured early, it can be managed. There are questions around, is it a sexually transmitted disease where people have been passing myths around? Yes, it is transmitted as a sexually transmitted disease. And yes, there are myths that have been passing around that it's a new disease. It is not a new disease. It's been around in some of the countries, but all the way from 1958, and I believe from Moses' presentation, you've heard much more about the disease itself. There are those who have also been carrying around the myth that this has been created in a lab. It's not been created in a lab. It's a zoonotic disease, and remember, we are having challenges of climate change, and things are crossing over from animals to humans. Today there was a case of hyenas hanging around town, and definitely that tells you if the animals are leaving the parks to come to where humans dwell, there are things that will spread and pass around. So some of those are the myths, but we'll keep sharing, we'll summarize, we'll have a document that you can be able to read and be able to highlight some of the myths and misperceptions. And also you as journalists, you hear a lot of myths and misperceptions in the community. Please share with us so that we are able to give you facts where the myths have been shared, and you be able to share back to the communities where you find these myths and misperceptions.
Yeah, thank you very much, Dr. Joy. Maybe I can also weigh in on some of the questions that have been asked, and the rest of our colleagues. We have Mr. Maina here, and we have Moses. So concerning, I think this is a question that was raised by Mercy, that what is the government doing to sensitize the members of the public? So I think immediately when the first case of Mpox was confirmed in Kenya, we immediately send out an alert to all our healthcare workers, the health facilities, and the community health promoters, At the same time, we've done a lot of sensitization to the CHPs and the healthcare workers. So we have a total of 3,891 community health promoters who are actually responsible for the households within their areas. So they are the ones who are going house to house, sensitizing the communities on how to detect. And then if they suspect that there's a case within the household, then they report to the CHP, then the CHP reports to us. And at the same time, they're also able to refer them to the health facilities for further investigation. Then they're also sensitizing the communities on preventive measures, what measures they need to put in place in order for them not to get the disease. And so they have also created networks in the community so that when something happens within the community, then they are able to inform them. Then the other question I think Mercy asked was that from the presentation, does it mean that the disease cannot be detected immediately like in VIVID? So I think Moses mentioned that the incubation period for Mpox is between 5 and 21 days. So, and by saying incubation period, it means the time when you get exposed to the virus until the time you show the signs and symptoms. So that is the incubation period. So some people take 5 days from the time they get exposed, others take 6 days, others take 10, others take 21. But we've actually seen, according to the information that you're getting from Nairobi, the average number of days is between 5 and 6 days.
Ruth, maybe you can mute Robert.
Oh. Yeah, so it takes an average from the 5 from the 5 cases, they have actually taken an average of between 5 and 6 days. So and we are told that before someone shows the signs and symptoms, you may not be able to detect the virus in them. So the only way that we confirm Mpox is through laboratory confirmation by analyzing the swabs from the lesions and sending them to the lab. So we confirm it through the lab, and it takes 2 days for us to get the results. And the laboratory where these samples are tested is National Public Health Laboratory. So it takes 2 days for us to get the results. So she also asked another question, that how ready are our health facilities to manage or to handle cases of Mpox? Yeah, our facilities are ready. We've actually sensitized slightly above half of our healthcare workers. We've also sent them the SOPs to all the healthcare facilities, so they're able to refer to them. And we've prepared our isolation facilities, both in the public and the private and FBO facilities. They have prepared isolation centers, and as of today, we have a total of 192 beds that are ready to receive and manage Mpox cases. So sorry, SOP is standard operating procedure. Sorry for that. Then the other one was, yeah, I think that one somebody was asking that if this disease does not have a specific treatment, is saying that we could also be suppressing the virus, but the virus is self-limiting, and we all know that most viral infection does not have a specific treatment. So, but they resolve. But if they are not treated well, we tend to get complications. So these are the complications that we want to make sure that they don't occur. Like if we are suspecting that the lesions are infected, then we need to do antibiotics treatment so that we prevent sepsis. If they are fever, we reduce the fever, but the virus itself is self-limiting. It will actually exit later. So I don't know whether there is any other question that I have not answered.
There is. I don't know whether you answered this one, that from Masigaki, that does it mean that disease that cannot be detected immediately, like in COVID?
Yeah, I think we cannot. I said we cannot test in our facilities. We cannot test the same in the facilities within Nakuru, but we have to send the samples to National Public Health Laboratories, Nairobi. So it takes 2 days for us to get the results. So it is basically like COVID, that we have no capacity to test in our laboratories around here. So they are tested in National Public Health Labs. And again, they actually do concurrence test. The first test they do in National Public Health Lab. The second test they do in Kemri, just for concurrence. Right. I don't know if I've answered.
Yeah, there was a question here on, I think, an explanation of what is meant by isolation of patients, as well as the preparedness of our CHPs.
Yeah, isolation means we cannot mix the other patients that have other conditions with the Mpox patients. So meaning that we have a special facility or wards. They are basically wards for the Mpox cases. So that is where we manage them from. So we actually manage in isolation, but we don't but we manage them in isolation where we manage them alone, so that they don't infect other patients, and also they don't infect other people. That is what it means. Then we have quarantine, which I think it didn't come out clearly during presentation. So quarantine is basically making sure that the people who came into contact with the Mpox patients are those people do not mix with other people, just in case they develop symptoms. So we have to put them on quarantine. Remember, these people do not have any symptoms, but we have to manage to observe them in quarantine for 21 days. And currently, the quarantine is basically self-quarantine. We advise them to ensure that they minimize movement and they don't interact so much with the people, so that if in case they develop symptoms, they don't infect the other persons. So for CHPs, we have sensitized them just like the healthcare workers. We have sensitized them so that they're able to detect cases of Mpox, and then send them to the health facilities and report to us. At the same time, they are able to educate the communities or create awareness on preventive measures.
All right. Thank you so much, Ms. Kipto. Daniel Kipchumba has again raised his hand, but there's also a question here from Maitha Grace, who asked, when was the first case detected in Nakuru? Because I saw in the presentation 30th September. Of course, we are not yet, we've not hit 30th September. So it's, you want to respond to that before we hear from Kipchumba again?
Yes, so our first case was confirmed on 30th August. And as Moses said, is that 7-year-old male truck driver who was actually on his way from Mombasa. He was on transit to Rwanda. So along the highway around Kikope area, he was unable to continue with the journey, and he called the National Public Health Emergency Operations Center, informing the National Public Health Emergency Operations Center that he's suspecting that he had COVID, and so he wanted assistance. So we dispatched an ambulance that evacuated him from there to our isolation center. So the patient is doing very well. He's actually on the road to recovery, and he will be discharged the day after tomorrow.
Thank you so much. And I think Moses also emphasized that fact that this fourth case that was reported in Nakuru is related to the fifth case that was reported in Mombasa, because these are a couple, the man, then the wife in Mombasa. So, Kipchumba?
Yeah, thank you, Elizabeth. At least tumeguzia, but nilikuwa nataka kujua how many CHPs have been trained. Is it that umetrain all the CHPs in Nakuru, ama umetrain a section of them? And kama ni section, how many are they? And then wakati Moses alikuwa anazungumza, alitaja kuwa mojawapo ya jinsi ya kujikinga na ugonjwa huu ni kunawa mikono kila wakati. Je, kama county health department have you thought of zile water points ambazo tulikuwa nazo wakati wa corona? Wakati huo zilikuwa zinatoa maji, some of them. Sasa hizi baada ya corona mambo yakawa hakuna maji. Nimefikiria kuongeza hizo water points ama kurudisha zile ambazo zilikuwa na maji. Alafu pia amezungumza Moses akasema kuwa tuna wale ambao wanatagusana na wale ambao wanaweza kuwa wameathirika na ugonjwa huu wavae PPEs. Wale county health promoters wamepatiwa PPE ama wanatagusana tu na community namna hiyo kavu kama jinsi ambavyo walivyokuwa wakati ule wa corona? Kwa sababu nilifuatilia wakati mmoja nikiproduce story and I talked to some of the county health promoters, walikuwa wanazunguka tu kwenye jamii namna hiyo kutafuta watu wa corona, hata hawajajikinga wao wenyewe. So nafikiri hayo matatu ukijibu utakuwa sawa.
All right. Over to you, Elizabeth.
Yeah, thank you very much, Kipchumba, for those questions. I think I will start with the number of CHPs that have been sensitized. As at today, we had actually reached a total of 1,226 CHPs sensitized, and the activity is still ongoing. And then for the healthcare workers, I think according to our station report today, I think we were at around just slightly above, was it 1,400? So those are the number of CHPs that we have sensitized. So what was the other question? Sorry, the other question, remind me.
Yeah, Moses alizungumza kuhusiana na kunawa as one of the way moja ya kujiprotect. So I'm asking, kuna water points za kunawa hapa Nakuru ambazo zilitengenezwa wakati wa COVID, na unakuta sasa hivi wakati COVID ilienda zingine hazina maji. Je, mnafikiria kuongeza ama kuna mpango wote wa kuprovide at least zile water points ambazo ziko na maji kwa ajili ya kunawa kama wageni wanakuja mahali fulani ama raia wanapita mahali kama town au na mahali ambapo wanaweza wakanawa? Alafu swala la PPE, our county health promoters ambao wanaenda kuangalia jamii kila siku kutoka asubuhi, wale ambao umesema kwamba mmetrain, mmewapatia PPEs ama wanaingia katika jamii waenda kutafuta Mpox ama report ya Mpox huko ndani bila PPEs? Tumesema kwamba the first thing kwanza ni kujikinga wakati ambapo unasikia kuna maradhi haya.
Yeah, thank you very much for those questions. For hand washing facilities that were established during COVID-19, we are now reviving them. For instance, in our health facilities, where they need repairs, we actually doing that, and we are encouraging the businesses within town to ensure that they have hand washing facilities at the entrance of their premises. Like today, I was somewhere in around Nyamakoroto, and I saw an eatery that had a hand washing facility outside, which was new. So I think as we also work together, we'll also ask you to pass that information so that we work in collaboration to ensure that we reach a number of people and a number of businesses within the shortest time possible, all of us. Then for the PPEs for CHPs, you realize that currently we have only one case, and that case is it's not actually a local case. It is an importation from Rwanda. He got the disease while he was in Rwanda. So for Mpox, I think it is a little bit easier to control, unlike COVID-19, because the major mode of transmission is through contacts. So, and we're actually telling them to avoid close contact with the persons. But if they suspect that someone could be having Mpox, even the members of the community, then they shouldn't come closer to that person, but put on the appropriate PPEs. However, in all our healthcare facilities, we are not allowing anyone to go to the health facilities without a mask. Our patients that are coming to the health facilities, the visitors or the caretakers of the patients should actually wear their masks, and they should clean their hands frequently within the premises of the hospitals, because this is the place where it is high risk. And therefore, again, for the CHPs, as they are going to the households, their kids also have they have gloves and they have masks. And again, when they come to our health facilities, they are also encouraged to get the masks before coming into the facilities. Maybe Dr. Joy or Waziri, you can add.
And maybe as they get ready to add, there's a question here from Jilopa Ezra, who's asking, what measures will you take to ensure that the CHPs are safe without getting the disease? Quite a lot of interest on CHPs here. I don't know whether we can move on, considering that we have paid quite some attention to what is being done with the CHPs. But in case you think there's still anything that you may want to add, you can still take over the floor and respond to that. But the other question I would also wish to ask is, now that Mpox is majorly, its source, it's a zoonotic disease, coming from animals, and majorly, our contact also, with the wild animals. Is it time then we keep off that that stretch at as you go to Nakuru, like Nakuru National Park, where sometimes there's a lot of contact with the baboons there? Or am I overthinking?
No, you are right. In fact, our major objectives in prevention and control of Mpox is that we want to prevent human-to-human transmission, and secondly, to ensure that we actually do not have human-animal transmission. So it is important that we ask the members of the public to keep away from these animals. Because if we have Mpox transmission going on in Kenya, then there is likelihood of it escaping from human beings to the animals. So that is one of the things that we need to encourage the public to ensure that they don't come into contact or they don't come close to these animals that are likely to either give us the disease or we give them. Thank you.
Great. Thank you so much. So that's a great story over there for any journalist. Keep off the baboons, but not the lake, because as you go to the lake, you are in the tour vans and so on. But at that point where we have summit and so on, there's usually a lot of contact. I don't know. I can't see more questions. Yes, Dr. Mugambi and Dr. Maina.
Just also as the story evolves, because the likely danger that would happen is when you're told to keep off baboons, you also keep off the park. Remember, it's also our revenue source. It's not that we are running away from our recreation sites. We are just ensuring we protect each other between the human and man. The only thing we are discouraging is contact. You find people even feeding the monkeys, and sometimes they are touched by the monkey, and you don't know if you yourself could be a risk to that monkey. Whatever you're feeding them, you're endangering them. We've not had reported cases of mpox amongst our wildlife. And so as much as it's coming through the border posts to us, we try and keep the animals that we are protecting also safe.
All right. Maina?
Thank you. I think Dr. Joy has addressed a number of issues that I wanted to talk about. Thank you. Because, within, let's say, it's not all monkeys that have the mpox strain. So as that interaction between now the humans and the animals, then we are likely to introduce maybe that grade 2 to our monkeys and baboons within Nakuru. So I think it's a good barrier that we ask people not to feed them, not to get closer to them, still watch them from a distance. Visitors are welcome to continue, seeing them from a distance and visit our parks. Then we are also we also are saying that our CHPs, as director has alluded, is that they will move around, and they have been trained as we continue sensitizing them that their work is referral, because there is the community and the case definitions. That is where we are stressing that if they get, such situation, the rashes are there is hotness of the body, they should be able to refer to the nearest facility where we have a skilled health worker who is trained now on case management to be able to undertake differential diagnosis. And that is very important so that not every rash that is seen, as you have been shown by Moses, we know how to differentiate the different types of rashes on bodies, because we also have measles that children will also present the measles rash. So those are things that we are also asking that the CHPs are to support us to be able to refer, and that's why we have that jeshi kubwa at the ground level to be able to pinpoint those cases, refer them. And where we have maybe people who are not willing to go to the facility, then we can have us informed, so we can also be able to visit the homes and be able to undertake sensitization and also management. Then I think we will also what happens where to us who live where we cohabit with baboons. I think you may be living within around, and that's what we are saying is that not unless the strain is introduced into the baboons, it does not mean the baboons currently have the mpox strain in Nakuru. No. But if the human-animal interaction, that should be dissuaded and discouraged. And I think we are also corroborating the next question from Daniel. And director will address it. We are also, as a county, working towards with other stakeholders under One Health. That's within the livestock, the KWS, because of other even zoonotic diseases. And that is a vibrant system in Nakuru, where we meet periodically to discuss even diseases like rabies. That's when you see even vaccination happening. And also any animal-human interaction, like what Dr. Joy talked about, sighting of hyenas around the Baraka Estate in Nakuru, that is under One Health. And the CHPs on the ground are able to pick that one out, relay the information, and is taken between health, livestock, KWS, and the entire team. So it's a vibrant system that happens in Nakuru within the disease surveillance system. Thank you.
All right. Thank you so much. If we don't have any other question, I think I will take it back to Magak.
We have one more question from Wanjiro Kenuthia. Please unmute and go ahead.
Thank you so much, Ruth Magak. I hope I'm audible enough. I think I would want to say thank you for clearing out that not all baboons currently carry a strain that could even transmit mpox. But mine is to ask, what is the county in collaboration with the KWS doing currently? Because you have areas that baboons freely come to households like freehold, free area, among other areas, and it happens on a daily basis. So to limit interaction with, I'd say, wild animals to them is hard. It's like on a daily basis they'd expect baboons to be at their homes. What is the county doing towards this? Because it might be causing alarm to them, because as the layman's person in the street is saying, Mpox is being bought by baboons. How then do you convince them that they're safe, and what is currently happening to ensure that they're also safe? Should we have a strain being carried and you're not aware of it at the moment?
Yeah, thank you very much, Wanjiru. I think that is a very good question and a very valid concern. I know there's a lot of interaction, especially interaction between humans and wild animals, especially along the KWS border. And it is actually a major challenge, I think, because of encroachment of human beings into the park. And you're also seeing the effects of climate change. The animals are leaving their natural reservoir and coming to where people are, including the hyena that was roaming around today. Actually, it escaped from the park. And I think we have a surveillance system where we are working in collaboration with the KWS Environment, Livestock and Veterinary to ensure that if these animals come to where humans are, then they are immediately informed and then they come for them. But for baboons, I think it is a little bit difficult. But I think the best thing for the communities around there is to ensure that they take the necessary precautions so that they actually do not come into contact with them. I know some of them even enter into the houses. It is a challenge. But I think what we need to do currently is to ensure that we ensure that we do not get additional cases of Mpox in this county by ensuring that our surveillance system is very sensitive, and then putting preventive measures in place to ensure that we prevent it from coming here. So that is the only tangible solution that we have for that. So we may not be able to prevent the baboons from coming to where people are, but let's do as much as possible to ensure that we do not come into contact with them, but we also ensure that we keep Mpox away from this county. Dr. Joy?
Thank you very much, Elizabeth, for that. Just to a feedback to Mercy Gaki. She's asked about public transport. Those are next steps, also sensitizing the matatu owners and the matatu businesses in terms of the hygiene and cleanliness, because ensuring each round of matatu transportation, they clean up their buses and ensure that they are clean, inclusive of the taxis and the boda. But there is work that has already started, and Director Elizabeth and the team. In addition, when you board the matatu, try and put long sleeves, carry some sanitizer, ensure you clean up your hands, and ensure that you also air the place so that you're not in an enclosed space for a long duration.
All right. I hope Magak and everybody else has also taken note of this suggestion from Kipchumba that perhaps we also think of adding water points at Nyayo Garden, perhaps.
Yes, we've taken note of that, Mr. Kivandi, and thank you so much. And we will be sure to incorporate all the suggestions that have been made in the session in the chat box, and feel free to even still send them in beyond this session. So I want us to end there because we've gone several minutes past time. But before then, Mr. Maina, yes, you can go ahead.
Thank you. Sorry for this. I think there was a question by that gentleman, Muswahili, sijui alimuita waje. Thank you. The one that asked because of the information being relayed, from where can he get credible information in this county? As alluded by Moses, Director Public Health, Director Elizabeth Kipto, is the incident manager for the purpose of these MPOX management and surveillance in this county. So any information that anyone may require, I just need to get directed to Director Elizabeth, and you have the credible information from the situation report daily. So that is very much available. That's what I wanted to pass across. Thank you.
Thank you so much, Mr. Maina. And I want to take now this moment to thank everyone who joined us in this session. We do not take it for granted, and we hope to see you some other time again. In case you do have any questions, interest in covering stories, in hosting any of our leaders in your shows to talk about MPOX, feel free to reach out. And we will continue to do this work. So, Madam Elizabeth, I want to invite you to in turn invite the CC to close for us. Thank you so much. But before then, I want to specially acknowledge Prince of Nakuru TV. He has streamed this live. So we had people who had joined us from the YouTube channel where we streamed this, and this message we encourage you to share it widely so that the public know how to prevent MPOX, how to respond, where to refer to. And thank you so much, Prince, for hosting us on the live, and we hope to work together better. And this also to our leadership so that next time we want to get such a service, then we know where to reach out to.
Yes, thank you very much, Ruth, for that. So I want to thank each and every one of us for participating in this sensitization. It has been very fruitful, and we truly appreciate your presence. So I want to take this opportunity to welcome our CC, and Joseph Madenge is asking whether he can interview our CC. I don't know whether it is now, but I think Waziri, maybe you will let us know. So thank you, Karibu Waziri.
Thank you very much, Director. Thank you very much, everybody, for attending this sensitization meeting. Thank you for your frank engagement, and thank you for all the feedback that you've given to us and the challenges that you've laid for the consideration of the department. We want to assure you that we have had, and we'll work towards filling any gaps that you may have identified and communicated. With regard to the interviews, I have actually so far given 2 interviews. Most of you know that I'm media shy, but I've already given 2 interviews with regard to MPOX. I'm happy to continue to do so, but as discussed and as you've had the conversation this evening, it's quite technical, and we are a fairly open department, and we have appointed Madam Elizabeth Kipto to lead us in the technical communication on this matter of MPOX. However, on the general discussions, I'm happy to weigh in whenever called upon. I think what the gentleman, is it I've forgotten his name, from Mamlaka, is asking for an interview next week. I think it should be fine. Let's have a coordination with Ruth Magak, time allowing. Is that all right? Ruth, I'm sure you can be the intermediary to set that up. I think it should be fine. Yeah?
Yes, Waziri, that is very okay. I will be able to link anyone who wants to do that.
That's fine. All right. And we thank you very much for the partnership. May I wish all of you a restful evening, and we will continue to meet in such spaces, such and similar spaces. And I thank you all very much.
Yeah, thank you. Thank you very much, Waziri, for those comments. So I now want to invite Wendy to lead us in a closing prayer.
Good evening, and thank you, Waziri, thank you, Director, thank you, colleagues, and thank you, our partners. Let's believe and pray. Father, in the mighty name of Jesus, we come before thy throne this evening, Jehovah God, to say thank you. We want to thank you for the entire day because you've been with us. You've given us grace, wisdom, knowledge, and understanding. Thank you, Jehovah God, even for this platform that you've given us to be able to share information, Jehovah God. This is to the benefit of the population of Nakuru. Lord God, as we continue sharing more information, we ask you to guide us and protect us. Tonight, we ask for peace as we sleep. As we wake up to the new day tomorrow, we shall not forget to say thank you. Bless each and every one of us, for we thank you in this, we believe and pray in Jesus' name.
Amen.
Amen. Thank you. Good night.
Thank you. Thank you, everyone. Good night.
Good night. Bye.
Good night.
Good night.
Thank you.